Now, the buttock is an interesting structure. It has muscle, fat, skin, and the bony frame, right? So, the muscle, the gluteus muscle, it's like a spindle shape, football shape that attaches here down to the outer thigh. And imagine it like that. I will draw it for you. So I'll squeeze for me, please. Okay, I try to get the margins of it. I know where it contracts. Relax. Thank you. So I know I'm going to go around this way. That's what the existing buttock is. We're going to go around like that. Then I like to find where the tail ends, and when I push down on it like that, it sort of marks itself, meaning I can see the end of the tail on both sides. I can take a mark and go out. And I try to follow that all the way where the femur or the thigh bone gets into the pelvis, where there is a depression. I follow that. I go here, I say this is the mid-thigh to me. This is important. I look at the mid-thigh and I try to imagine a straight line up to here. Bring it down. These are general markings, basically. I found helped me. They developed with years of experience. First of all, I'm going to go where there is a dip and push up, and I see this is not going to go like that. There's a depression here, so I want to make that like this. So what do? I mark right through my roundabout. I call my dimple my roundabout, because you can see there's a lot of meeting through this line. And I look at her from an angle. Come back this way, please. And you can see how it's flattened here. So come back. I need to help her with this area as well. These are the areas that we need to fill. It goes like that. So I'm going to follow this pattern and fill up this region, including this depression. You see that? To give her more hip for her waist, to really give her a 0.7, which is a really ideal waist to hip ratio. And you can see it on this side as well, that needs it. Now, that's the back. I'd like to approach, I changed my approach to the butt augmentation. I like to start with the contouring first, and then move to the volume part, projection. Here is my contour. It's not comfortable because I don't numb the bottom, but you put small aliquots of fat. You don't want to put bulk. Keep moving as you inject. Go here. I follow my gluteal muscle. I know where it is. I know what it looks like. I want to build a shape similar to it above it. Thank you. So far, this is our third syringe. Each syringe is about 50 to 60 mLs of fat. If the patient's size is a small grapefruit, you cannot make that a watermelon. So the volume of fat changes depending on the size and frame of the patient's pelvic in relationship to their thighs. Finish on this side. Let me just mold her now. I like to mold the fat, and you can see extras coming out. Follow the gluteal. The gluteus muscle is like this. You fill it like that. Mold it, mold it. I know it's not fun. Patients don't like the massage part, but it's molding, it's crucial. The fat disruption really makes the fat look like cream without losing its properties, the good properties. I have never seen a buttock after fat transfer go back to what it used to before. People worry about fat loss after transfer. What really happens is they lose the swelling that they enjoy after surgery. After they see that go away in a couple of weeks, they believe that the fat has died and went away. Actually takes several months for the fat to commit itself. And with a good take, some people 60-80% of fat lives in the transferred area. So I think it's a myth that you will lose all the fat transferred. I haven't seen it in my experience. And you can tell what we're doing here is fixing the potholes more than projecting her, as much as fixing the topography of the gluteus, skin and fat layer. And sometimes when you have too many depressions like that, the volume goes to fix these potholes or depressions and does not project like you would like it to. Because first you got to fill up all these holes. This is the last one. We gave her a total of 660 mLs on both sides, and that's all the fat that she gave us, pure fat that is. Her total aspirate was about 3,000 mLs of fat and solution, and we got close to 1,300 cc's of good pure fat. You can see the excess coming out. It's good to mold in the form of the gluteus muscle, which is a spindle shape, football shape in this direction. People think, it's also another myth that fat transfer increases cellulite or makes stretch marks. No, it does not make stretch marks. But if you do have stretch marks and when you tighten up the skin or stretch it, they become more apparent. Here's the final shape today.